Hello, I'm Dr. Manu Nayar, consultant pancreatic physician working at the Freeman Hospital in Newcastle upon Tyne, United Kingdom. I'm here to talk to you about our recent publication in GI endoscopy, which is a comparison of the diagnostic performance of two core biopsy needles for EUS-guided tissue acquisition of solid pancreatic lesions. EUS-guided tissue acquisition of pancreatic lesions has now become standard of care for obtaining tissue in these group of patients. However, in spite of the developments in tissue acquisition, when we use strict cytological criteria, even in expert hands, the diagnostic accuracy is only around 70 to 80%. This results in the patient either having a second procedure or repeat imaging, both of which delays necessary treatment. To get around these problems, newer needles were introduced into the market, and one of the group of needles, core biopsy needles, was introduced a few years back. The most commonly used core biopsy needle in practice is the reverse bevel tip needle by Cook Medical, or the Proko needle. This needle has been extensively studied, and over the last year or so, multiple randomized controlled trials and meta-analysis have not shown any difference in either the diagnostic yield or diagnostic accuracy between the core biopsy needle and the fine needle aspiration needle. A new needle has recently been introduced into the market. This has got a novel design with 6 cutting edges and has got an opposing bevel and an independent sheath design which lets us leave the needle inside the echo endoscope. The aim of this study was to see whether this particular core biopsy needle had a better diagnostic yield and diagnostic accuracy as compared to the most commonly used needle in the market, i.e. the Proko needle. The study was conducted at the Freeman Hospital, which is a large tertiary referral centre for pancreatic disorders. This study was done between April 2013 and July 2015. Consecutive patients with solid pancreatic lesions, so cystic lesions were excluded from this particular study, were included in the study. In the first half of the study, almost all the patients had tissue acquisition with the Proko needle. This was followed by the second half where the Charcot needle was used. Multivariate logistic regression analysis was performed using variables in both the comparative groups. There were no complications related to the EUS-guided tissue acquisition in either groups. The results suggest that the diagnostic yield or the adequacy of tissue with the Charcot needle was 99% as compared to 87% in the Proko group, and this was statistically significant. In addition, the diagnostic accuracy of differentiating between benign and malignant lesions was 91% in the Charcot group as compared to 74% in the Proko group, and again this was statistically significant. There are very few studies in literature focusing on the new core biopsy needles. Di Maio and Kandal et al. Have recently published on this particular core biopsy needle, but both these groups have reported smaller numbers and have probably not focused purely on solid pancreatic lesions. There are obviously a few drawbacks in our study. It is a retrospective design, but we feel that the multivariate logistic regression analysis did not show any difference between the two groups, so it's unlikely to be a major factor in terms of comparing the two needles. In addition, the pathologists were not blinded to the biopsy samples taken from the needle. But again, we feel in our unit, because every sample is reported by 2 very experienced pancreatic pathologists, it's unlikely that blinding would make a significant difference in reporting of the samples. One of the other things we've also done in this particular study is focus on the strict criteria for diagnosis, i.e. diagnostic for malignancy. There have been multiple studies in literature where patients with inadequate samples have been excluded from the study, or patients with diagnosis of suspicious of malignancy have been clumped together with those with diagnostic of malignancy, thus giving us a falsely high yield and accuracy. Therefore, this is really the first study or large preliminary cohort study to compare the two commonly used core biopsy needles in the market, and it has shown that a change in design has resulted in a higher diagnostic yield and a higher diagnostic accuracy. This can have significant ramifications because this is the first evidence to suggest that a change in the needle design can result in clinically relevant and quite a large improvement in diagnostic accuracy, even if EUS techniques and histopathology logistics are taken into consideration. If our results are reciprocated in a randomized controlled trial, we certainly feel that this new type of core biopsy needle design would become standard of care for acquisition of tissue in solid pancreatic lesions.